There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, how do I lower blood pressure naturally and quickly? Answer by Roy Gillen. There are many effective ways to lower your blood pressure. The following is a summary of the American Heart Association, AHA, recommendations. Home monitoring. The AHA recommends home blood pressure monitoring for all people with high blood pressure. Track your blood pressure. Take control over your situation. Tracking your blood pressure helps you and your physician to understand your situation better and tailor your treatment. Try my app, My BP Blood Pressure Tracker. Click here to check it out. Weight. Even a 10-pound weight loss can help lower blood pressure in overweight people. Overweight people are at risk for multiple health problems. Diet. Make smart choices. Try to follow the DASH dietary approaches to stop hypertension. Diet. Eat more fruits, vegetables, low-fat dairy products, whole grains, fish and nuts. Limit consumption of red meat, sweets and sweetened drinks. Reduce sodium consumption. The AHA recommends no more than 2,300 mg/day, ideally less than 1,500 mg/day. In Western countries, most of the sodium comes from processed food and not from your salt shaker. You can estimate the amount of sodium in your food by looking at the nutrition fact label. Try to keep a healthy diet and make smart dietary choices as mentioned above. Potassium. Potassium-rich diet is important as potassium reduces the negative effects of sodium. The DASH diet provides many sources of potassium. Physical activity. Regular physical activity has many health benefits besides lowering your blood pressure and is one of the most important things you can do to improve your health. The American Heart Association recommends for most healthy people at least 150 minutes of moderate intensity physical activity, e.g., brisk walking. Each workout should last at least 10 minutes and it is better to spread them throughout the week. Try to incorporate strength workouts at least 2 days per week. You should take it easy and progress gradually. Try to build a plan you can stick to and make it your routine. Walking is recommended as it is easy, fun and can be social. Alcohol. Limit your alcohol consumption to 2 drinks/day for men and 1 drink/day for women. Medications. Medications may have important role in your treatment. Remember that naturopathic approaches are not a substitute for medications. Most probably, your doctor will recommend adopting lifestyle changes along with your medications. Over-the-counter medication, OTC, always read their labels. Look for warnings regarding high blood pressure. For example, decongestants may raise your blood pressure. It is recommended that you discuss the topic with your physician and decide together on your treatment. Remember that a key to better control is a good doctor-patient partnership. Medical disclaimer: the comment contains general medical information. Do not use the information as medical advice. The information is not a substitute for medical advice. No warranties or representations are given in relation to the medical information. Please consult your physician if you have any questions about any medical matter. Answer by Laurel Harper. Hi John. There's no straightforward, easy fix, simple answer to this. I don't know what your usual BP range is. I don't know your family history, your age, your weight to height ratio, your race. I presume you're male. I don't know your lifestyle or your diet. Without having this information, I can't know if you likely have hypertension, if you have pre-hypertension, if your BP is elevated at all, if it's likely primary hypertension or secondary. So this is what I can do for you, John. First, here are some abbreviations to make this go faster for me. AHA equals American Heart Association. BP equals blood pressure. HTN equals hypertension. SBP equals systolic blood pressure. The first number in, for example, 116/72, shows how hard the heart must work, contract, to pump blood out into the arteries. DBP equals diastolic blood pressure, a reflection of how well the heart rests between contractions. Several years ago, the AHA determined that a normal BP range is 90,119/6,079. 120/80 hasn't been considered normal for a long time. The AHA also determined that pre-HTN is 120/80, 139/89. HTN is 140/90 and higher until you get into the range of malignant HTN. There are 2 types of HTN: primary and secondary. primary, also called idiopathic and essential, is associated with factors that can't be changed, managed or controlled. These factors include such things as gender, age, race and family history. Secondary HTN is associated with factors that can be changed, managed or controlled. These factors include such things as obesity, lipidemia, diabetes, sedentary lifestyle, excessive stress or poor stress management, drinking, smoking, high fat and or high sodium diet and so on. Primary HTN will usually require an antihypertensive medication because you can't change the factors that drive it. Secondary HTN is managed by a combination of medication and changes in lifestyle and or diet. So, John, try this. Check your BP on 3 different days at 3 different times of day. For example, MWF. On Monday, take it when you wake up while still in bed. On Wednesday, take it midday or early afternoon. On Friday, take it in the evening or before going to bed. If any values are consistently elevated, I suggest you see your doctor. After reading my answer, you may be in a position to decide what you have a HTN you can change on your own. BTW, you don't want changes in BP that are too rapid. Answer by Dr. Vivek Baliga. There are many ways to reduce your blood pressure without medicine. The first way is to lower your salt intake. Make sure the quantity of salt added when cooking is less. Also, avoid hidden salts such as cheeses, pickles and preserved foods like canned foods. I have a guide to lowering blood pressure without medicine which you can find here.